Okay. All right, so now I'd like to introduce our next presenters, Drs. Kenny Fent and Miriam Siegel. Dr. Kenny Fent is a research industrial hygienist at the National Institute for Occupational Safety and Health and lead of the National Firefighter Registry program. Dr. Siegel is the lead epidemiologist for NIOSH's Firefighter Registry team. She completed her doctorate in epidemiology with a concentration in occupational epidemiology at the University of Kentucky as a Central Appalachian Regional Education Research trainee. So today, Drs. Fent and Siegel will be talking to us about the National Firefighter Registry. The National Firefighter Registry is a voluntary registry of firefighters that is designed to help us better understand cancer in the U.S. Fire Service. Congress mandated the NFR's creation through the Firefighter Cancer Registry Act of 2018. The National Institute for Occupational Safety and Health is leading this program. Our goal is to better understand the link between workplace exposures and cancer among firefighters. When it launches, the NFR will be open to all U.S. firefighters, regardless of whether they have a previous cancer diagnosis. So in this presentation, we will hear them provide an update on their progress in setting up the NFR, an overview of how they plan to register firefighters, and how the data can be used for the ultimate goal of understanding and reducing cancer in the fire service. So on to Dr. Kenny Fent.
Good afternoon, and thank you for this opportunity to give an update on the National Firefighter Registry. I wish I could be there in person so I could see all my friends and research partners, but soon enough. I do want to mention that my colleague, Dr. Miriam Siegel, will be present after this presentation to answer any questions that you might have. So in the United States, there are over 1.1 million firefighters that protect our homes, communities, and environment. Every year, these firefighters respond to roughly 1.4 million fires, and about 500,000 of those are burning structures. Exposure studies have shown that there are hundreds of compounds released from burning materials. Over a dozen known carcinogens have been identified on the fire ground, and even more probable and possible carcinogens have been measured as well. So this is an exposure pathway diagram, and it really illustrates just how complicated the exposure process can be, at least for firefighters. It's not just what firefighters may inhale during a response, but also what may contaminate their PPE and equipment and transfer to their skin or off gas from their gear and so on. Just over the last decade, a number of epidemiology studies have provided evidence of a link between firefighting and cancer. One of the most pivotal studies was actually conducted by NIOSH, what we call the 3-city cancer cohort study. And this study found increased risk of being diagnosed and dying from certain types of cancer compared to the general population. Several other cohort and case control studies have also found elevated risks of specific types of cancer. However, the cancers have varied across the study populations, with important differences noted by sex and race. But the data for females and minorities, unfortunately, have been really sparse and generally lacked sufficient power to draw conclusions. A few studies have identified exposure-response relationships, but even that data has really been limited. So by looking at some of these past studies, we can certainly draw some conclusions, but these studies also lead to additional questions. So, studies have generally reported a link between firefighting and cancer, and certain cancers are consistently elevated with some variation in risk estimates. We know that some variation is probably caused by how firefighting status is ascertained, and there are disadvantages to classifying firefighters based on cancer registry or state fire service records alone. So we might just miss, who is a firefighter. Additionally, little information exists beyond simple occupational status. Few studies have been able to analyze exposure response relationships using incident records. The NIOSH 3-city cancer study was one of those studies that was able to do that. But there's a lot more to evaluate, to learn what is it about firefighting that may increase the risk of cancer. Analyses have demonstrated that cancers among demographic subgroups appear to be what we would say consistently inconsistent, meaning that there hasn't been much consensus about which cancers are elevated among select groups of firefighters. But it does appear that women and minority firefighters, who comprise roughly 8% and 20% of the fire service, may have unique experiences as it relates to cancer risk. And it's conceivable that women and minorities may absorb and metabolize chemicals differently or have different biological responses to their exposures. So a lot is still to be learned about how the risk for cancer varies by demographic subgroups, subspecialties of firefighters like volunteers, who represent about 70% of the workforce, or wildland firefighters, and also across different regions of the country. Some past studies have indicated that the magnitude of risk associated with firefighting may still be relatively small compared to some lifestyle factors like smoking. But most studies haven't been able to really account for those personal and behavioral risk factors for cancer and how those may interact with occupation to affect firefighters' risk of cancer. So in short, there are no central or comprehensive sources of data that provide details about firefighters' occupation, personal risk factors and behaviors, and then most importantly, cancer status on a national level. So these knowledge gaps really contributed a great deal to the development of the Firefighter Cancer Registry Act of 2018. And this act provided a mandate to CDC NIOSH to develop a voluntary registry of firefighters for monitoring and evaluating cancer and cancer risk factors. The goal of the National Firefighter Registry is to, track cancer and risk factors over time so that we can better understand the link between workplace exposures and cancer. Our mission is to generate detailed knowledge about cancer and the fire service through a voluntary registry that reflects our nation's diverse firefighters. And our vision is to then equip the fire service and public health communities with the knowledge they need to reduce cancer in firefighters. We always say that our ultimate goal is to reduce cancer incidence and mortality in firefighters. Lastly, our protocol, which was developed with input and guidance from our NFR subcommittee, which included experts in both the fire service and scientific disciplines, really has provided our overarching objectives. And those objectives include collecting self-reported information from firefighters on their workplace and personal characteristics through an online portal, which we'll talk about more, obtaining records from fire departments or agencies so that we can track trends and patterns of exposure, and then linking with health information databases, including population-based cancer registries, and then the National Death Index so that we can detect cancer diagnoses and death. It's really important to note that all firefighters will be strongly encouraged to join the NFR when it launches. Not just those with cancer. The NFR is really more of an exposure registry than a cancer registry. And this is essential for understanding the difference between firefighters that do and do not develop cancer. Firefighters' participation in the NFR is entirely voluntary, but we do hope to enroll 200,000 or more firefighters. And we will have a recruitment emphasis on women, minorities, and volunteers that are specifically called out in the Act. We're also interested in various subspecialty groups that really have been understudied to date. And those include fire instructors and wildland firefighters and fire investigators. So there'll be actually 2 enrollment routes that are part of the NFR. The open cohort will be what we call a non-probability sample, for which any firefighter, whether they're active, former, or retired, will be eligible to participate. And this enrollment route is beneficial for recruiting a very large and diverse sample, but unfortunately may not be generalizable. You can imagine that firefighters who already have cancer or, are very concerned about their health may be more likely to participate than others. The targeted cohort will be a prospective cohort of active structural firefighters recruited from rosters from selected fire departments or state agencies. The targeted enrollment allows us to select firefighters throughout the country from a geographically diverse department of various sizes and less susceptible to selection bias than the open cohort. This design also allows us for focused enrollment of women and minorities and volunteers and other kind of understudied groups of firefighters. And importantly, also allows us to more easily access incident records so that we can do a more detailed exposure analysis. The way in which firefighters will enroll is still under development. And this is really taking the longest time because of some of the new data security requirements that have really just come out within the last year or two. And of course, data security is our top priority. And it's absolutely critical that we get this right the first time and that we can protect the data and protect firefighters' privacy. So even though it's still being developed, we do know that enrollment will involve informed consent. It is a voluntary registry, so we have to have informed consent. We'll collect some basic information from the firefighters about themselves, so that'll likely comprise a user profile. And then we'll have a more detailed enrollment questionnaire that'll collect information on demographics and work history, workplace practices, lifestyle, and health history. And we estimate that the enrollment will take about 30 to 45 minutes, where newer firefighters will be on the low end and more experienced firefighters will be on the high end of that estimate. And that's simply because more veteran firefighters will have more work history experiences to report. And then there will also likely be important voluntary follow-up questionnaires that'll happen periodically after firefighters register. For some groups of participants, we also plan to obtain exposure information from department records, as well as exposure tracking apps when available. So we know that there are many firefighters that are, documenting their own exposures through these applications, and they should have an opportunity to also provide that information to us. We understand and appreciate that if a firefighter is diagnosed with cancer, the last thing on their mind will be to report their cancer to NIOSH. So instead, the cancer information will be determined periodically by linking information collected through the NFR with data from all state cancer registries so that we can determine cancer incidence, as well as linking to the National Death Index to determine cancer mortality. The North American Association of Central Cancer Registries, or NACER, will also have a new virtual pooled registry, or VPR, and that will also be useful for assessing linkages. So this figure shows the data sources that we're interested in capturing. Of course, the web portal, or the NFR registration system, is really the common denominator among the NFR participants, but also for some participants, having department records and exposure tracking information. And so you can imagine all of that data getting funneled down into our exposure database. And then that database is later linked to the health outcome databases, which primarily includes the cancer registries, the state cancer registries, and the National Death Index. So the Firefighter Cancer Registry Act states that we should ensure that the information in the NFR is publicly available as appropriate, while also protecting the personal information of or personal privacy of the participants. So, we are obtaining an assurance of confidentiality, which is the highest level of protection allowed by the federal government. And this will ensure that participants and fire departments and other institutions like state cancer registries, that NIOSH will protect the confidentiality of the NFR data. We're also pursuing a secure mechanism for making de-identified data, so data stripped of identifiers, making that data available to our external researchers via the use of research data centers. And research data centers are federal data warehouses responsible for protecting the confidentiality of the participants while providing access to restricted use data for external researchers to be able to do all sorts of statistical analyses. So this is that figure again, but we want to make that de-identified data that's collected as part of the NFR available to our external researchers so that they can analyze that data and really just maximize the benefit of the data for the fire service. And so this would include self-reported questionnaire data and incident record data. And then we may also be able to link NFR data with or without health outcome data to external study data through active collaborations with external researchers where participants overlap and where consent is given. So you can imagine, an external researcher maybe, collecting detailed exposure data or measurements from firefighters in their study, and those firefighters may also be participating in the NFR. And if we have consent to do those linkages, we may be able to link those two data sources together. So once a firefighter registers, we want to maintain regular communications with them. It's really important that the NFR is, that we're constantly reaching out to the participants and letting them know about different opportunities. And it's not just a one-time thing that they're doing. And so our communication platforms will include, newsletter updates and emails or text messages with links or notifications, as well as website resources. And so these platforms could be used to share resources related to external research opportunities, exposure tracking programs, firefighter health and wellness programs and initiatives, important research findings, whether it's related to the NFR or other research, and then also major events like upcoming conferences and things like that. So we definitely want to work with our stakeholders to be able to deliver a lot of this important messaging to the firefighters who participate in the NFR. Most importantly, the data that's collected for the NFR has the potential to address many of the existing knowledge gaps that I mentioned before. And these include, how much cancer and what types of cancers exist among firefighters, and how does the cancer risk vary among the different groups of firefighters, or with the use of certain control interventions? Are we seeing a reduction in cancer risk, for example, among firefighters who have implemented certain control measures? How does the cancer risk vary geographically? And then also, and importantly, how does the cancer risk vary with increasing exposures, including major events? So, we hear a lot from firefighters that, there's one or two big, fires that they attend where they're really concerned that that may increase their risk or did increase the risk of cancer. We can also look at current workplace and lifestyle behaviors among firefighters and how that may change over time with the registry. And then we can also do data quality analyses, looking at self-reported cancer versus cancer diagnosis information from registries, just as an example. So we've made a lot of progress over the last year, especially. So we did establish the National Firefighter Registry Subcommittee, which includes 13 members with backgrounds, in the fire service as well as public health and scientific disciplines. And this subcommittee was really instrumental in reviewing our protocol, consent form and enrollment questionnaire, and giving us feedback and guidance, which we largely implemented in the current version. We also submitted a questionnaire for Office of Management and Budget review, OMB review, which is required for any survey of the public. We also drafted an assurance of confidentiality, which I mentioned previously, and that's been submitted to CDC for review. And then we began the planning and development of our registration system and database. As I mentioned, that's taking the longest time because of the security requirements, but we are making significant progress on that as well. And we continue to meet with our fire service and public health stakeholders. And, it's just essential that we can have those communications with those stakeholders. So we are on track to launch the registry in 2022. And when enrollment opens, we will work closely with all the fire service stakeholders, scientific stakeholders, public health, medical, all those different communities. We'll work closely with them to notify firefighters throughout the country. We want all firefighters in our nation to know when the NFR opens and that it's available for them to register. Until then, you can find out more information on our website listed here. You can sign up for our quarterly newsletter at our website. And you're also more than welcome to contact me or my team, and all that contact information is listed here.
Thank you so much, Dr. Fent, for sharing this really critical information on the National Firefighter Registry. I'm really excited today that we have Dr. Miriam Siegel with us live to answer some questions. So please feel free to submit your questions in the chat. We do have one question already coming through. So Dr. Siegel, if you can answer, what are the current studies and data on why female firefighters and firefighters of different ethnicity and color get different cancers?
That's a really great question, and thanks to whoever asked the question. I know that topic comes up a lot, and it's a knowledge gap that really still needs to be answered. But I know there's been a few studies that have been able to look at female firefighters and minority firefighters as specific individual groups in terms of the cancers we're seeing among these subgroups. For example, the large 3-city cohort study that Dr. Fent described in the recorded presentation was able to look at some small groups of women and non-white firefighters and found some select cancers to appear elevated among these groups, but they weren't necessarily statistically significant. And the reason for that being that the sample sizes were so small for these groups. We know that these groups make up a minority of the fire service, but still a substantial part of the workforce. So it's really important that we understand cancer risk among these groups. Because as Dr. Fent mentioned, biological processes, the metabolism of different carcinogens, as well as just social determinants of health can be different across different demographics. I will say there's also been some studies out of Florida, University of Miami, and their cancer registry, as well as California's cancer registry, looking at non-white and female firefighters as their own groups as well. So it's certainly an area that needs further study.
Great, thank you so much. So are there any groups of firefighters that are of greater interest to the registry?
Well, we're certainly interested in looking at these demographic subgroups. Women, minorities, and volunteer firefighters are specifically called out in the Firefighter Cancer Registry Act, which Dr. Fent described, and that act is available if you wanted to look it up online. But we're also interested in looking at other understudied subgroups of firefighters. This is a really good opportunity to get a very large and diverse sample of firefighters to be able to inform what we know about all sorts of different practices and subspecialties like wildland firefighters or firefighters from specific geographic areas that might fight in hotter climates versus colder climates, certain architectural structures, or airport rescue, industrial firefighting. We're certainly just interested in answering a lot of understudied questions, but I would certainly say women, minorities, and volunteers are of particular interest.
Great, that's really great to know. And so after a firefighter registers, are they done or will they need to come back to the registry with more information? And how will firefighters know when to register?
So after firefighters register, we'll be able to get a lot of basic information about their work and their life and their health through this very comprehensive survey, this questionnaire that they provide at enrollment. But we're hoping to have this platform that's very engaging and gives firefighters the opportunity to come back to not only update information about themselves and their work and their contact information, but also have the opportunity to provide us information on special topics of interest through follow-up questionnaires. Now, those won't be mandatory, those will be optional, but they'll be a really good opportunity for them to provide more information that informs firefighter cancer analyses. Enrollment hasn't begun yet, and we're hoping enrollment to begin sometime next year. And we'll make sure to sound the alarm and make sure that all outlets are aware. We have a website. It's www.cdc.gov/NFR. We'll make sure to post that information on our website. We have a newsletter that you can subscribe to now. We produce quarterly information on that newsletter, and we'll also be communicating with the unions, firefighter interest groups, individual departments as well. So, and presenting at conferences like this one. So you'll be sure to hear from us.
Okay, that's great to hear, and we'll definitely share this on our platform, how to register for the NFR. There's one last question. Do you know of any studies from Europe or any other countries that show cancer risk factors for firefighters?
Yeah, there's been a lot of great international work out of several different countries. I know that other countries have been able to produce mortality studies, just like that was from the 3-city study. So I would certainly look into some of that international research. There was a recent mortality follow-up that came from Spain, I think published last year. And again, there are some emerging trends about which cancers appear to be elevated in firefighters, as well as some geographic variation. So it's certainly an international effort that I think the continued collaboration and communication about this topic are really great.
That's awesome. Well, Miriam, thank you again so much for joining us live and answering these questions. This is such an important initiative, and we're so glad that your team could be here to present.
Thank you. Thank you for having us.